So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing that.
Wow, you're saying that I'm opening up people to violence by asking whether or not women are the folks who can have pregnancy?
What we just witnessed is exactly what happens when plain old common sense crashes head-on into the bizarre lexicon of radical academia. Senator Josh Hawley asked a straightforward question, nothing complicated, nothing controversial, and somehow he got accused of committing violence. You couldn't script it. And honestly, it reveals everything about how far certain corners of the academic elite have drifted. This wasn't a debate. It was a full-blown unraveling over the definition of a single, ordinary word.
Mr. Chairman, thanks to all of the witnesses for being here. Before I want to visit with you, Ms. Matzke, but before I do, I just want to clear one thing up. Professor Bridges, you said several times, you've used a phrase, I want to make sure I understand what you mean by it. You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh, so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing that.
Wow, you're saying that I'm opening up people to violence by asking whether or not women are the folks who can have pregnancies?
So I want to note that 1 out of 5 transgender persons have attempted suicide. So I think it's important.
Because of my line of questioning? So we can't talk about it?
Because denying that trans people exist and pretending not to know that they exist.
I'm denying that trans people exist by asking you if you're talking about women having pregnancies?
Do you believe that men can get pregnant?
No, I don't think women can get pregnant.
So you are denying that trans people exist?
And that leads to violence? Is this how you run your classroom? Are students allowed to question you?
Absolutely.
Or are they also treated like this, where
No,
they're told that they're opening up people to violence?
We have a good time in my class. You should join.
Oh, I bet.
You might learn a lot.
Wow, I would learn a lot. I've learned a lot just in this exchange.
Absolutely.
Extraordinary.
Yep.
Ms. Matzke, let me ask you something. So you provide health care to women free of charge, right? Is that right?
Absolutely.
You've done this for many years.
Yep.
You have licensed medical professionals at your pregnancy care centers. Is that right?
That is correct.
What are some of the resources that you provide for women who come to you in a time of need? So, just give us you talked about it in your written testimony, but just give us a sense of it.
So we have 3 OBGYN doctors, 5 registered nurses, nurse practitioners, physician assistants, phlebotomists, medical assistants, and we provide prenatal care, OBGYN care. We provide pregnancy tests, ultrasounds, well woman visits, breast exams. We provide a wide range of medical services. Yes.
So what do you think about the DC politicians now saying that your clinic and the other 3,000 pregnancy care centers around this country are fake medical clinics? For instance, Senator Warren has said it's now more important than ever to crack down on so-called crisis pregnancy centers that mislead and deceive patients. Senator Menendez, crisis pregnancy centers jeopardize women's health and well-being, all while elevating unproven theories about birth control. Senator Warner wrote to Google asking them to censor search results for care centers like yours, saying directing women to fake clinics that traffic in misinformation is dangerous to women's health and undermines the integrity of Google's search results. Do you run a fake clinic? I mean, is that what's happening here? You don't provide actual medical care to actual women?
We absolutely do not run a fake clinic, and we have a full medical staff Like I said, many of our medical professionals have experienced abortion for themselves, including our OBGYN doctor who used to perform abortions. So our entire medical staff is there for women, whether they choose abortion and walk out the door or whether they choose life for their baby, and we support them for years after that.
Do you think there ought to be an ideological test to be able to get medical care in this country? I mean, should we say to women, well, you have to agree with the DC Democrats' ideology, otherwise you can't go get medical care? Or maybe for you and the physicians who work at your pregnancy care center or the thousands of others across the country, should we impose an ideological test on them and say that, well, you have to agree with the DC Democrats' position on abortion or you can't provide medical care to women? Should we do that in this country?
Absolutely not.
I just want to ask in my few remaining seconds here, Ms. Hawley, the Dobbs decision, as I understand it, I've read it now a number of times, it gives to voters the decision as to what laws should be pertaining to life and pertaining to abortion in all 50 states and other jurisdictions around the country. I'm just curious, do you know what percentage of voters in this country support the DC Democrats' position that they want to impose on the entire country, a one-size-fits-all rule they want to impose from the top down? Do you know what percentage of voters support their position, which is also, by the way, the same position taken by North Korea and China, other notable violators of human rights? Do you know what percentage it is?
I know that nearly 90% of Americans oppose abortion in the third trimester. The number that would support abortion up to the moment of birth has to be minuscule. It's a horrific policy.
Yeah, I mean, based on the most recent Harvard poll that was just released just a few days ago, it's less than 10% of voters say that they would support abortion into the final month of pregnancy, and yet that is the law that the DC politicians want to impose on every voter in America, to take this away from the people, take it away from my state, take it away from all the other states and the voters in the states, but impose this law uniformly that is not supported by 90% of the American people. Talk about anti-democratic. At the same time, they want to shut down 3,000 pregnancy care centers all around this country. That's radical.
And that's why we need to watch the entire exchange. Because this one moment exposes the cultural divide in America more clearly than any speech or think piece ever could. Let's roll the full clip and see how something so simple spiraled into something so surreal. All right, we're back, and now we need to actually break this moment down. Because two huge things happened in that exchange, and both say a lot about where the country is heading. First, let's talk about the opening clash. Senator Hawley calmly asks Professor Kiara Bridges to define her own phrase, people with the capacity for pregnancy. This is a Senate hearing. They're talking about laws. Words matter. So he follows up with the question any society for thousands of years could answer instantly. Would that be women? Instead of answering, or even trying to explain her terminology, she immediately goes on offense. She won't say the word woman. She calls his question transphobic. And then, incredibly, she accuses him of opening people up to violence simply for asking a basic biological question. That is the new playbook. Don't debate, don't explain, don't defend your claims. Just accuse the other side of hatred, bigotry, or violence, and you never have to justify anything. Hawley is stunned, like any normal person would be. He asks a factual question, and suddenly, he's violent. Then it gets even stranger. She asks if he believes men can get pregnant. He says no, because men cannot get pregnant, and she claims he's denying trans people exist. The logic folds in on itself. And this is coming from a professor at UC Berkeley Law, one of the most prestigious legal institutions in the country. Yet she can't acknowledge the most elementary biological reality. Press her on it, and you become the threat. It's completely unhinged. But the second half of the hearing is just as important, and most viral clips leave it out. Once Hawley realizes he's not going to get a coherent answer, he pivots. He turns to Heidi Matzke, who runs a pregnancy center, a place that actually gives free medical support to women who are scared and pregnant. He asks her what her clinics provide, and she lists it out. OB/GYN services, registered nurses, ultrasounds, breast exams, prenatal care. Everything real women need during a pregnancy. And then, Hawley exposes the real conflict. He reads statements from Senator Elizabeth Warren and Senator Bob Menendez declaring these clinics fake and calling for them to be shut down. He shows how politicians have pressured Google to censor these clinics and make them disappear from search results, so frightened women can't even find help. Because these centers don't perform abortions, certain politicians want them erased, regardless of the free care they provide. That's Hawley's point. The same ideology that refuses to define woman is the same ideology trying to destroy the places that actually care for women. And his closing hits hard. He cites a Harvard poll showing that abortion up to the moment of birth, a position pushed by some DC Democrats, is supported by less than 10% of Americans. Less than 10%. By the numbers, it is radical. What Hawley pulled off in this hearing was a masterclass. Ask simple questions, stick to basic facts, and let the other side reveal just how extreme their positions have become. And reveal it, they did. They did.